I'm Congressman Jared Huffman. Thanks so much for joining me for this town hall. I am joined in an unprecedented way. I don't think this has ever happened before. We have not only your representative in Congress, but your representative in the California State Senate, Mike McGuire, and your representative in the California State Assembly, Jim Wood, all of us together, the full legislative team for this town hall. All of us wish we could be with you in person, but the consolation prize for being unable to do that is we get to do the first ever complete legislative team virtual town hall. And I'm really thrilled and honored to have both of them join me. They are terrific partners for me. We work as a team, and between the three of us, we should be able to field just about any question that you might have that involves the state or the federal government. Now, we are also joined by two public health leaders, and that's obviously important because all of us are thinking about the COVID-19 pandemic. So I really want to thank Mendocino County's public health officer, Dr. Noemi Doohan, and the president of Adventist Health, Dr. Jason Wells. Adventist, of course, not only in eastern Mendocino, but now on the coast. So a really important voice for healthcare and public health throughout the county of Mendocino. So each of us is going to make some brief opening remarks, the legislative participants. And then I'd like to turn to Dr. Doohan and to Jason and ask them to provide that public health update on the pandemic. And then we're going to go to your questions and try to cover as many as possible. You can start sending those questions in right now on Facebook Live. So just go ahead and type them in. And then my staff is going to relay them to me. And since there's sometimes some delays and audio challenges when you have multiple speakers in an online event like this, I'm going to try to do a little air traffic control. I will read the questions and then I'll try to direct them to the participants on the panel that seem like they're best directed to. But any of our guests and my colleagues at the state legislative level are welcome to just raise your hand and jump in as you see fit. So with that, I'll get started with just a few brief opening thoughts and on the specifics of what's happening with the COVID pandemic and how it's affecting Mendocino. I'm going to do what I often wish President Trump would do. I am going to defer to the experts who actually know a lot about what they're talking about. But I will talk about the policy implications and what I'm working on in terms of Congress's next steps. Now, you probably know that Congress has already passed some really big bills that have become law. The CARES Act, the CARES 2 package. We've provided trillions of dollars in resources that include not just individual stimulus payments, but small business loans, many of these loans forgivable, grants for small businesses, funding for hospitals, clinics, state, local, and tribal governments. Significantly, we expanded unemployment benefits, which in a place like California are often really not enough to make ends meet for folks that are out of work. But we increased that unemployment benefit to guarantee an additional $600 a week. And very significantly, we broadened eligibility. So it includes people who are self-employed, who are gig workers or contractors. Now, that really important part of the economic safety net during this pandemic is set to expire in a few days. And it's very important that we extend those unemployment benefits through at least the end of the year. But I think we need to do more than just that. Our state and local governments are desperately in need of federal support so that they can keep providing the frontline services we depend on. Schools are about to start up. The states are desperately needing help so that they can make the investments necessary to enable whatever form of in-person or remote learning or hybrid approach they think is most appropriate. But it's going to be expensive, and they are watching their budgets crash, so they need our help. Local governments are on the front line of all kinds of public health costs and service delivery. Their budgets are crashing too. They need our help. We need to do much, much more on testing and tracking and tracing and securing PPE supply chains. And so that includes requiring our president, who's been reluctant to do this, but we need to require him to use a very unique authority he has in existing law called the Defense Production Act. We can end all of these shortages that we're seeing in collection kits and transport medium and all the different things, the reagents that are always causing bottlenecks, the lab capacity, so that we can finally have enough testing and have the testing results back to us fast enough to make better use of it and get a better handle on this pandemic. We've got to make the Paycheck Protection Program, which is such a lifeline for small businesses, more flexible. We've got to extend its duration, and we've got to push it out through more community-based and smaller lenders, so we're not just at the mercy of big banks. And then finally, we've got to protect this fall's election. We've got to make sure that we're supporting the Postal Service so that we can have a safe and secure election that will rely more on mail-in ballots than any election we've ever seen. Now, the good news is all of that is in a piece of legislation I co-sponsored and we passed out of the House over a month ago. It's called the HEROES Act. When I go back to Washington Sunday, we're going to do everything we can to push the Senate and the administration to either support the HEROES Act or enter into serious negotiations with us to do something a lot like the HEROES Act, because all of those things I just mentioned, I think, are the necessary next step for Congress in response to this pandemic. We also passed a $1.5 trillion infrastructure bill a couple of weeks ago. It includes a bunch of my bills. I'm really excited about that. Bills on water infrastructure, on using our public lands to help deliver broadband capacity out to rural areas like the Mendocino coast, and then my bill to electrify the postal fleet. Just one last thing I'll mention, I'll hand off to my state colleagues. Next week, the House is going to be passing a bill called WRDA, the Water Resources Development Act. It is the big water resources bill that deals with the Corps of Engineers. And I want to share a little bit of good news. I was able to get a provision into this year's WRDA that will reauthorize the study to raise Coyote Valley Dam at Lake Mendocino. You may know that the Corps of Engineers had kind of tried to walk away from that study. We think it's really important. And we also have language in WRDA that will make permanent the forecast-informed reservoir operations that are so vital to stretching our water supplies and having not only better flood management, but better water supply benefits at Lake Mendocino. I said one last thing, but I actually have one more last thing. The other bill we'll be voting on next week in the Congress is the defense authorization. And sometimes this is just how the sausage is made, but I had an opportunity in the past few days to take my big public lands bill, my Northwest California Wilderness, Recreation, and Working Forests Act, which includes lots of great wild and scenic river and wilderness provisions in Mendocino County, as well as Humboldt, Trinity, and Del Norte. And we got it in the defense authorization bill. Don't ask me how that works. It's just Congress, but I'm pretty excited about it. And I'm hoping that this will advance what's a really good piece of legislation for managing our public lands. With that, I'll invite my colleague, Senator Mike McGuire, to go next and share a few opening thoughts, and then we'll go to Jim Wood.
Congressman, thank you so much. Congressman, you have been steadfast in your support of the North Coast. There is no one who is as fierce as Congressman Huffman defending what we need here in the North Coast of Mendocino County. I want to take a moment to say thank you. I want to acknowledge Assemblymember Jim Wood. He is the chair of the Assembly Health Committee, and he has been laser focused on the coronavirus. And I want to say thank you to his incredible leadership and hard work, and grateful to partner with him. And of course, to Dr. Doohan and Mr. Wells and CEO Carmel Angelo and the Board of Supervisors in Mendocino County for their leadership. Want to just start out with just some sobering news and where I think we're heading here in the state of California. Despite our efforts, folks should start planning for another 12 months of ebb and flow of this virus, at least here in the Golden State. Here's where we're at this point. Right now, Marin County, south of us, went into surge mode with ICU beds about a week and a half ago. Moving north this week into Sonoma County, in 101, they're about 2 weeks behind Marin. 61 of 67 ICU beds are now in use. And we are slowly seeing virus numbers continue to increase the further north you go on 101. And as we heard from Dr. Doohan earlier today, there is concern that Mendocino County is on the verge of the state watch list. Here's why we are so concerned in the state. We are about 2 months away from the start of flu season. And the reason why you're seeing the state taking dramatic action as we are, regressing back into more of a shelter at home format, is because our hospitals simply can't handle a surge when it comes to coronavirus and our typical busy season when it comes to flus. If we do not get this under control over the next 8 weeks, this state is in serious trouble, which is why you're seeing dramatic action by the governor and the legislature to be able to bring the surge numbers, which you're seeing almost in every county, under control. But I'd like to transition quickly to testing. Testing remains a challenge in the state of California and, of course, throughout America. We are working on being able to expand testing, contact tracing, and isolation programs. It doesn't do Mendocino County any good to have a 7-day wait time to be able to figure out if there is a positive test. And that is something that I know Dr. Wood and myself are very focused in on being able to continue to expand capacity both on the lab for processing the tests as well as testing sites. And I want to take a moment to say thank you to Dr. Wood for his partnership on getting an OptumServe site up and running in Mendocino County. And that was a 100% partnership with Dr. Wood, Dr. Doohan, the Board of Supervisors, and of course, CAO Angelo. And finally, talking about schools. This has been a significant anxiety, rightfully so, for so many across California. There are going to be 2 different categories for starting school this year. Schools who are in counties under the watch list and schools who are not. If your child is going to a school in a watch list county, you will be starting the school year with distance learning. The way schools will then transition off of distance learning is if that county has been off the watch list for 14 days. We are going to start emphasizing the need for teachers and classified staff who are working in schools to be prioritized for testing. And masking will now be required for any student 3rd grade and up if they're on a school campus. There's much more to come on this. I'll turn it back over to Congressman Huffman and again say thank you to your leadership. Thank you to Assemblymember Wood for all of his hard work.
That's good stuff there, Senator McGuire. Really appreciate it. And I know that you had a town hall with the State Superintendent, Tony Thurmond, just this week. So I'm sure we're going to have more questions about school reopening and safety and hold some of those thoughts. And we will definitely continue that part of the conversation. But we're going to jump over to the other part of this great legislative trio. You know, what's great about working with both Senator McGuire and Assemblyman Jim Wood, they've each staked out some of their own niches in Sacramento, and it gives us different levers of power that we can activate at different times on behalf of the North Coast. So it's a real great synergy. Jim chairs the Assembly Health Committee. We're glad to have you here, Assemblyman Wood. Take it away.
Thank you very much, Congressman Huffman. Thank you, Senator McGuire. It's a pleasure to be here. It's always daunting to go third because you guys have laid out so much of what's important that we discuss here tonight. I do want to hit on a couple of things that are really important. I think the Congressman nailed it. I mean, we feel like we have a really well-oiled machine here, working closely with Senator McGuire on so many issues. Our relationship with the county, Carmel Angelo, Dr. Doohan, and then of course our federal partner and I'll call you Doctor. Sorry, I'll call you Dr. Huffman just because, but Congressman Huffman. So we really are able to cover a lot of bases, and that's really critical for us in a rural county such as this. We have specific challenges that other counties don't have, and we're constantly fighting for just our fair share. So the fight to get a testing site for us was a big deal. And the work that we're doing with Senator McGuire and the superintendent of public education, and Cecilia Aguiar Curry represents Lake County on trying to get better broadband access to the North Coast, will go hand in glove with the work that Mr. Huffman is doing, Congressman Huffman is doing in Washington, D.C. We cannot let our children be thrown further behind because of a lack of access to high-speed internet, and that's going to be a critical thing going forward. I do want to say, and I know the other offices will likely mention this as well, but our team is up and running. Every office is up and running. We're just not in our typical offices every day. But I encourage you, if you have questions regarding and concerns regarding state agencies, particular EDD, we have been really working hard on the EDD issue. Feel free to call our office and speak with Ruth or Emily. The number is 463-5770. And we are there to help you as much as we can with any of these thorny type issues. But above all, I want to say, wear masks, wear your mask. The mask is not to protect you. It is to protect your mother, your grandmother, the waiter who might be serving you a meal outdoors, the grocery clerk, the first responder. So wear your mask. It's absolutely critical that you do that. And I know it's hot sometimes, and I know they're inconvenient, but if we're going to get a handle on this, we have to do this. And so we can't emphasize that enough. Also, we are working closely with the Health and Human Services Secretary and the governor's office. Testing is a thorny issue, but I want to tell you how far we've come in testing. You know, in the early stages, we were able to do only a couple thousand tests a day in the state of California. Recently, we hit 147,000 tests in a single day. And so that is putting a huge strain on the supplies, the supply chain, the labs, and every part of this testing mechanism. And so we're working to get our arms around that, because that reality of that number of tests and more needs to happen for the better part of a year, probably, if we're going to get our arms around this. So with that, I'd like to turn it back to Congressman Huffman, and let's see what our experts have to tell us today.
Yeah, thank you, Assemblyman Wood, and thanks for bringing up the unemployment issue and the fact that even though I described federal unemployment benefits, they're administered through a state agency, EDD, and so I do feel bad to some extent for my state legislative colleagues, because EDD is so swamped. I just read today there's 2 million case backlog, and we're constantly hearing about people getting delays, unable to get through to EDD. The agency is swamped, and frankly, the agency has not done a good job at processing these claims. And you know, most of those complaints fall to my two state legislative partners, but it is federal funding that's administered through a state agency. That's why it's good to have us working closely together. Okay, this pandemic is on all of our minds on the North Coast, and I'm so glad that we have our terrific Mendocino County Public Health Director to tell us the latest of what's happening on the ground, what it means. So Dr. Doohan, your turn.
Thank you, sir. And it's an honor to be with you gentlemen today. Thank you for including me. For the listeners that are joining us, I just want to share, for those of you who don't know me, that I'm a physician. I'm a family physician. I also have a PhD in molecular biology and a master's in public health. So it's possible that my fate was to end up being the health officer in a rural county during a pandemic so that I could serve the people of this county in my best ability, because I've been trained to do this my whole career. I am currently working to the south of Mendocino County as a hospitalist, and experiencing what it's like in the COVID wards. And actually, that's why I'm wearing my scrubs today, because that's where I came from. So I'm really the front line, boots on the ground person who can tell you the reality from the front lines. So I've been on the front lines from the beginning, and so grateful CEO Carmel Angelo is on the call here, because we've been shoulder to shoulder from that very first day, as well as with the gentleman on this call, my elected officials and the leader of our hospitals. From the very beginning, we watched the COVID situation unfold. We've been working without days off since January. And what we saw in the beginning was a picture where you had to ask, are we going to believe this data? Is this real? Is this really going to happen in California? Is it really going to make it to rural California when we have so many rural protections of space and wide open places? But all of this time, since mid-January, every single day in the public health department, in our EOC and our DOC, we've been preparing for today. And the day has come where it's here. COVID has hit, the tsunami is with us. And what that feels like being on the front line is like, I say this to Carmel a lot, it's like you have fires burning all around you and you're not sure where the fire trucks are and you're not sure where the firefighters are, and you hope you have shovels. And I'm really sorry to say that, but that is the reality right now, because I can't tell you exactly how many new cases we've had today, because the data is coming in a way that is so fast and furious. We don't have enough workers on the front lines, and we're doing our best to keep going and keep ahead of it, but the wave is hitting us. And that's the reason why I took a very controversial, perhaps, and bold step. I believe it was yesterday, the days blur to one and another, where I said, I'm going to act ahead of the governor, and I'm going to put ourselves on that watch list before the governor puts us on it. That's because I know, because I'm on the front line, it's inevitable. We are going to be on the watch list in the next couple of days. In fact, I had a phone call with Dr. Angel, our director, fantastic director of public health, and Susan Finelli yesterday, where I said, we're on the watch list. If our data isn't showing that to you, then our data isn't getting to you fast enough. The fact that I have to wait 10 days for a test to come back means that I don't even know what my numbers are today. I just know what tests came, people were tested 10 days ago. What I can tell you is we have 184 cases now in Mendocino County and 77 in isolation. Well, when I say we have 77 in isolation, that means those are new cases. These are fresh cases. So our curve is doing that escalation, that exponential rise that the data has been telling us would happen. All the modeling has been telling us would happen. And I was predicting, not because I'm brilliant, just because I've been watching and following and keeping track of the data, that it was going to happen right about now. Now, what has the governor told us about what the modeling tells us for this state? The governor tells us that this peak is going to keep going, and it's going to keep going, and it's going to hit us hard around Labor Day. And everything that I'm seeing on the front lines is telling us that that is the case. In Mendocino County, I would like my colleague in a moment will speak to this, but we have 9 patients in the hospital right now. I believe 3 are in the ICU. We had a death announced overnight in our very first outbreak in a nursing home in Fort Bragg. Fort Bragg being a frontier community where we are very far from a major city there. If you can get on a helicopter, you can get there fairly quickly, but if you have to get in a car and you want to get to a major city, it's going to be several hours. We have been meeting every week for months with our skilled nursing facilities to prepare to try and prevent an outbreak in a nursing home. But it's almost as if it's inevitable. How did Marin first get impacted by COVID? In nursing homes. How did Washington State, Seattle, first get impacted by COVID? Nursing homes. We've known this for months. We've done everything to prepare, and still it's happening. Tragically, having our first nursing home death in the last 24 hours. This is our second death in Mendocino County. The first death was announced several days ago. This was a death that we weren't clear if it was going to be attributed to COVID. This was a beloved gentleman who attended a church service with singing several months ago and ended up being infected with an outbreak at that church. And he ended up being hospitalized in Ukiah, being transferred to a nursing home several weeks ago, and died in the nursing home in Marin. So our first death was actually prolonged, and after he initially had COVID, and our second one was in a nursing home acutely ill. So we have been preparing, doing everything we can, and I could speak later on about all of the things we've done to prepare for this day to arrive. But I am saying, as a public health expert, that it has arrived. COVID has arrived in Mendocino County. The surge is here, it's now, and therefore we need to react with strength and with unity, which we are doing. And what that means also for me is to listen to our state leadership, listen to Dr. Angel, listen to the governor, and then follow suit in Mendocino County when it's appropriate. And in my expert opinion, that is now. So we are following the watch list in Mendocino County. I just released the orders just now that we are following the watch list restrictions that are for watch list counties. And we're doing that ahead of the governor placing that on us. And I will tell you, my expert opinion is it'll be within a matter of days that we are officially on the watch list. So I think that's enough for my introduction. I'd like to thank you all and hand it back to for a congressman.
Well, Dr. Doohan, thank you so much for your leadership during a tough time. I hope you're finding some way to get some sleep at least, and we're grateful for everything you're doing. Last set of opening remarks, and then we'll get to your questions. They've already started to come in, so keep them coming. But we want to hear from Jason Wells. He is the CEO of Adventist Health, of course, which has two very significant hospitals in Mendocino County. So, Jason, thanks so much for joining us.
You bet. Thank you, Congressman. So I pulled over. I wasn't driving. Heather's driving, but I was late getting away from work. So we're headed to grandparents' house for dinner. So that's why I got the seatbelt on, but the car's not moving. Thank you, and Dr. Doohan, for your partnership and for everyone's support through this. We do have 3 hospitals in Mendocino County, all working together now. And so Mendocino Coast is now part of the Adventist Health family. We have 100 beds in the county, and today 70 of them are filled with patients. So we do have 30% capacity. Of those, as Dr. Doohan shared, 9 are COVID patients. We have 4 up at Howard. We have 3 at Ukiah and 2 over on the coast. From an ICU standpoint, 3 of those patients are in the ICU, and so we have pretty good capacity still. We have 16 ICU beds in the county, and of those, about half are free. And so we've been planning for this since early in the year. Our teams on the coast and inland have been their surge planning. We have the capacity to go 45 additional beds above the 100. We've also done a virtual hospital, one of the first in the country. Time Magazine's going to have an article this month about it, which is exciting. It's a 25-bed virtual hospital. The patients are monitored very closely. We're doing home visits every day. So it's still acute care. It's just in the setting of the home. And so we have 2 patients admitted to the virtual hospital right now. So testing is our biggest challenge. And I appreciate everyone's recognition of that. We would love to test more. We have incredible multi-million-dollar equipment sitting there not being used. And it's all about the reagents. We have massive orders in. And of course, Adventist Health is a system with 24 hospitals. Getting those reagents from Abbott, from BD, from Cepheid, that is the biggest challenge. And I'm hearing it's actually the plastics. And so there's only few manufacturers making those plastics. But I agree with the Defense Production Act. If we could do that, we could simply get ahead of the testing issue. The ventilator issue seems to have been taking care of itself. We've realized how to treat COVID pretty well around the country. We're learning from New York and learning from others that went before us. We don't have a single patient on a ventilator in Mendocino County. We've had great partnership with the health department and others to get the cases of remdesivir. The counties around us have been incredibly helpful. We drove to Humboldt yesterday to get some remdesivir for a patient. And so the partnership we're seeing is exceptional at the state level, at the county level. Everyone's pulling together to get through this. I couldn't be more proud of the 1,400 team members on the front line of this at our 3 hospitals, in our clinics. I mean, just serving each and every day fearlessly. At other Adventist Health hospitals, Bakersfield, today we have 75 patients, COVID positive patients in the hospital. At Lodi, we've had 62 staff members come down with COVID. Some of those are community acquired, but we just are being incredibly careful. We're in tight spaces in hospitals where we work. Everybody's masking. We need everybody to mask, but we're really asking people not to come. And I know our staffs are doing it well. People have symptoms. Another challenge we're seeing is people coming to the ED hoping that's the best place to get their COVID test. It's not. Our testing supplies are so limited. We know in about mid-August to early September, we're going to see more come in the supply chain. Abbott's committed that we're going to go up about 200% more. BD is committed about 25% more mid-August. They're putting another line on, making more reagents, and they feel the plastic situation is going to improve a little bit. But we are right now maxed out on our ability. So we're testing, obviously, symptomatic. If someone comes in with the symptoms of COVID, we've got to know if they have that or not. Before we do a patient surgery, we've got to know, is that patient COVID positive? All of our inpatients get tested. And so, and then first responders, we need to make sure if someone has been exposed, we have the capacity to test our firemen, our policemen, our health department leaders, and frontline people, nursing homes. We've done some great testing with the breakout on the coast. And so appreciate those partnerships. As I wrap up, again, I covered the ICU bed situation there. We're pretty good on that front. The final one, I guess, would be materials. We are solid on gowns. We just had another 600,000 gowns get through customs, surgical gowns for isolation, masks. We have been able to take 2,000 masks over to Sherwood Oaks to help them with their outbreak. And we're going through about 16,000 masks a week just in Mendocino County. So a lot, to keep our staff, keep our patients safe. So we appreciate the partnership, and we're certainly eager to answer some questions.
Well, that's wonderful, Jason. And sorry, I misspoke about the 3, not 2 hospitals. Thanks for cleaning that up. Glad to hear you're getting those masks and other supplies. I was just talking to Kaiser and Marin, though, and they shared that they had a huge order of PPE that got confiscated by FEMA. So I hope you're grabbing those supplies as soon as they hit the airport and locking them down and hanging on to them. We have begun to get questions. So we're going to spend the next 30 minutes on your questions. And the first one I've got is a pretty easy one. It's just for me. Gary asks about the frustration with Mitch McConnell stopping the bills that we've been passing in the House on the next step on the pandemic and what we can do about that. I am beginning to see a little bit of a thawing in what was initially a no-go position from McConnell and from the administration. Now, I think some of the ideas they're cooking up for their response are non-starters. The president is demanding a payroll tax cut, which doesn't help 40+ million people who don't have jobs right now. They're not working, so a payroll tax cut does nothing for them. And Mitch McConnell really wants this broad blanket immunity for all businesses. That's bad policy. And, we can't go for that. But they're beginning to talk about the need to support state and local government. This unemployment insurance expiration is going to put a lot of pressure on them. So stay tuned. I think we will get to a deal. It just may not be for another couple of weeks. All right. So back to the issue of school reopening. And I think Senator McGuire, you're probably the one for this. Mark asks about the governor saying that schools will be online only. And he's asking whether the state is going to provide a laptop computer and high-speed internet access to all students free of charge. I think we'd all love to see that, but what is your understanding of whether there will be some infrastructure assistance that comes along with that remote learning plan?
No, I appreciate that, and thank you for the question, and I'll be quick. So bottom line is this. Those who will be starting in distance learning, the mandate will be in those counties that are in the watch status, if you will. So currently that is Marin and Sonoma, and is what we just heard. Once Mendocino goes officially under the state watch list, that mandatory distance learning will take place. So right now there is a significant push thanks to the work of Assemblymember Wood and of course the entire Digital Divide Task Force, who's working on securing additional devices for districts to be able to get them secured and into the hands of students. The challenge that we have in Mendocino County or in Humboldt County, Trinity and Del Norte, is that even if we get every student a Chromebook, they may not be able to get a cell signal to be able to power that Chromebook. So this one-size-fits-all approach when it comes to distance learning, especially in rural California, is an acute challenge. So what we're working on right now is an alternative plan that should be released before the start of school for those students that may not have a signal, even though they may have a device such as a Chromebook. I don't want to be coy, Congressman, and I hate to say this, but stay tuned, more to come. And the state will be dedicating tens of millions in resources to be able to secure those devices, as well as to help support those districts. So even though if they have a device, to be able to support those students that may not be able to get a signal.
But your point about the needs being different in different communities is an obvious one. It may be a MiFi, it might be a laptop here and there. It's one reason why I think it's so important that Congress provide that $1 trillion of relief to states and local governments, because your needs are going to be different than some other states. And we need to just recognize that you've got a lot of costs associated with trying to keep the public schools open during this pandemic. That's what I'm hearing. Jim Wood, did you want to jump in at all on the school reopening piece?
No, I think Senator McGuire hit the nail on the head. I think a lot of this is going to be evolving. And I think the critical thing to remember is that it is going to, a lot of how we reopen is going to be predicated on where we are, whether we're on a watch list or not, or whether we have been asked to shut down our activities or not. So that is the challenge. But, can't emphasize enough our digital challenges with the lack of infrastructure to do distance learning and things like that. I apologize. The thing about these calls is you have critters that appear from nowhere sometimes. So, but it is hugely challenging for us. So I would note too, with regards to the masks and anyone over third grade and older is going to be required to wear a mask. The governor just purchased about 18 million masks for children today, which will be important. But a lot of this is going to continue to evolve, and my concern around the distance learning is the inequity for many folks in our communities. If you don't have the device, that's one thing. If you don't have the signal, the device means nothing to you. So we're continuing to work hard on that, and we hope that hope we'll get some relief at some point.
Great, thank you. And your cat just shows that you are a friend of nature, Jim. We appreciate that. I've got a question here. I've got a question here from Cynthia, who asks about the state's limit on travel, and I think this is probably best directed at Dr. Doohan. Or if I know Carmel Angelo is with us as well, if she wants to jump in. But there's a question about travel outside of 50 miles, and yet some concern that people are continuing to travel to the Mendocino coast. So what's going on with that? How will that be managed in the next phase of where we're heading?
So the tension with the sheltering in place orders of the health officers, not only in Mendocino County, but across the state and across the nation, is enforcement. How do you enforce it to tell someone you can't travel into another county? Of course, it's completely unenforceable. So what my orders say is that you should limit recreational travel to 50 miles straight line on a map. And I did that because if you are in Mendocino County and you go straight 50 miles straight line in a map, you can go anywhere within our county. So the message there is, to the extent possible for recreation, limit your travel to within the county. But that doesn't limit travel for other essential elements like needing to go for medical visits or work. But how do we restrict tourism coming into our county? And this is another area of great tension in our county. There is no way that we can limit tourism, can't enforce it. But also, I'm recalling something that Supervisor Williams told me, and I think this is right, that about 70% of the economy in our coastal Mendocino area is from tourism. I believe that's right. So if we limited tourism and said there is no tourism in Mendocino County, we would cause a great harm to the economy of our coastal, beautiful and beloved coastal area. So it's been a real balancing act in Mendocino County. What I've done is I have not closed, when the governor opened up hotels for tourism and leisure, I did the same in Mendocino County with some restrictions, which is that I required that the hotels keep 25% of their beds empty in case they had an outbreak in their hotel, or also that they needed to have cleaning, each room dark for 24 hours for cleaning, so we didn't have to put too much stress on the workers, which tend to be from the Latinx community, who are going to be deep cleaning these rooms. So I would say that we cannot restrict tourism in our county. It's a county that depends on tourism, but we're asking the business community, we're asking the leaders in lodging to be ambassadors, and they have been. So we set up an ad hoc of the Board of Supervisors with Supervisors Sturdy and Williams to work with West Company and the lodging community, just as one example of what we've done, to be ambassadors to those tourists who come to say, please, treasure our beautiful Mendocino rural county, wear a mask, wash your hands, social distance, don't come here if you're sick, etc. So what I can only say is travel and tourism is part of our reality, and unless the governor shuts that down again like he did in the beginning of this epidemic, we will continue to have tourism in Mendocino County.
Dr. Doohan, well, we've got you. And on that point, there's a question from Lori, who's in the lodging business. And she points out that she's taking all of the precautions, feels like she's providing a safe environment. But there's still these new cases, and she wants to know, where are they coming from? Because she doesn't think that they could be coming from establishments like hers, given the precautions that they're all taking.
Yes, and I do want to commend the lodging industry in our county of doing an excellent job collaborating and participating in our self-certification process that West Company set up. It's quite innovative in the state of California, what we've done. The fact of the matter is, I am not aware of any outbreak in a single hotel among workers in that hotel in our entire county. I would tell you if I was, I wouldn't at this point tell you which hotel it was in necessarily, unless they had violated health officer orders or they were unsafe, but I can tell you there hasn't been one. However, what I cannot tell you is whether a tourist has come who's had COVID and visited that hotel and transmitted COVID to our community, because when those individuals go back home to their home counties and they're tested there, we don't get that information. And so we don't know if tourists are spreading COVID in our county. We don't have that information. We don't have that data. And that's one of the reasons I started out by saying I'm fighting fires and I'm not sure where they are. We're not tracking that data because we don't have the ability to track that data at this time. So I would believe that there are tourists coming into our county with COVID. Hard to believe they're not. But certainly none of the workers in the hotels have been known to have COVID, and there's been no outbreaks in hotels that I'm aware of since our very first case, which actually was in a hotel.
Okay, thank you for that. Let's go over to Jason if we can. Ron is asked about hospital ICU capacity and wants to know if are we going to make sure that we're leaving capacity within our county hospitals for residents, and that capacity doesn't all get gobbled up by folks who are visitors and traveling to or through Mendocino. And you're muted. There you go, Jason. Okay.
Unmute. Good.
You're good.
Yeah, okay, perfect. Yeah, so obviously that's a chief concern of ours, that we are here to care for the 90,000 residents of Mendocino County. It's not often, it's pretty rare that we get a tourist in our hospitals. I mean, we have an occasional heart attack somewhere, but I think Ron's question is probably around COVID. If someone's here vacationing and comes down with COVID, would we be taking them in? Obviously, we're here to care for everybody that comes to us. But, traditionally, how that would come is if someone felt the symptoms, we would certainly hope they would go home, shelter in place. We can certainly diagnose that and get them where they need to be appropriately. Physicians are really driving that type of care. But I feel good that we've got surge plans in place, that we flattened the curve. And that's why I want to say thank you to the community for the time that it gave us to get ready. And so that extra time was incredibly helpful, again, to watch and learn from New York, other places, Jersey, that went before us, and to learn the protocols, put the procedures in place. But that is our intent, is that we will always have ICU beds for this community. One of the values of being a part of a large system like Adventist Health is we have been moving nurses to Bakersfield, to Glendale, Lodi, places we have hotspots, and moving resources around. So instead of just the handful of ventilators we may have, we have over 1,000 ventilators at our disposal. So should Mendocino County, we're socially distanced already by just how we live and the geographic spread of our community. So I don't ever expect things like Los Angeles County and some of the things Texas are seeing, but those extra IC beds are key. And as we continue to wear our masks, as Dr. Wood asked us to, and everybody else, we will do well. We prepared well, and we're going to make sure we have the IC beds we need.
All right, appreciate that. Greta is asking about local bankers and local micro business owners supporting a bill that's in the Senate that would allow a single page attestation to forgive PPP loans less than $150,000. And Greta, I'll take a look. I'm not aware of that specific bill, but I know that we, in our HEROES Act, we're trying to make it simpler, more flexible. And you're right, some of the complexity of actually applying for the PPP and then making sure you can figure out how to use the money while maximizing the amount that's forgivable. I do understand that it needs improvement. So we'll take a look at that bill in the Senate and see if that's something that we can support. Okay, Callie is asking about Callie Dim from the Little River Inn. Just seeing your name and your question, Callie, makes me want to have some of those delicious Swedish pancakes. They are the best in the world. And the question is about Coastal Lodging working to tax the guests 1%, that they can then give that to the clinic to increase testing. when the OptumServe contract expires, can the Mendocino Coast clinics have some of those Quest test processing spots? So this is about the testing bottleneck. And I guess I would open it up to either Dr. Doohan or Jason if you want. That's a pretty creative thing that folks on the coast are trying to do to solve their testing bottleneck, but everybody is scrambling for a very inadequate supply of test kits and materials. Any thoughts in response to that question from Callie?
Who would you like to go first, sir?
Go ahead, Dr. Doohan.
Okay, that's a very complex question. So let me first say thank you to the lodging community for looking at creative ways to help our county. I think we've gotten messaging from the state that eventually some of these resources that we've been very privileged to receive may not be free to us any longer. And certainly it was a heroic, I will call it a battle to get OptumServe to our county. And that was done by our elected officials here on this call, with as well as CEO Carmelangelo, myself, and others. But we have been told it's not going to be free forever. It's free to us now. I want to say that for the clinics on the coast, they have been fantastic partners. MCC, Lucretia Renteria, for example, in Fort Bragg, they have been fantastic partners because they have been partnering with us to do outbreak testing. So we have OptumServe, and then we can also do outbreak testing at the State Public Health Lab in Richmond, California. As well, the clinics can send samples to Quest in the normal way that a test is done in any clinic at any time. So these elements of the public health lab in Richmond, California, the commercial lab that the clinics can send away to, and the OptumServe resources work together. And we're going to have to find ways to fund this testing in the future that will take collaborative partnerships, such as with our business community. So I'm not sure if I answered the question, but I just did want to point out that there is the expectation that in the future, we're going to have to find a way to fund this.
Yeah. And so many of these things do come back to the need for some federal funding to help all of that actually work. But if we could, I want to, before I lose you, Dr. Doohan, and go to another panelist, we have a question from a hairdresser. Says the county says hairdressers can operate outdoors with safety measures, and state licenses will be yanked, she understands, if they do. So can you help unscramble the potential conflict between what I think this person is hearing between the county and the state? Are the rules for the state licensing board being relaxed for outdoor operations? Have I got that right?
That's such an important question. I mean, as in this rapidly evolving event, we come across these types of situations where the governor's given us guidance, the health officer follows, and then we find ourselves between a rock and a hard place where I don't know the answer to that question, actually. But ours is not the only county that's telling people to have their hair cut outside. It is very clear that being indoors in closed quarters without ventilation to the outside is dangerous with COVID. If somebody is in a closed room with another person who has COVID, we know that COVID is spread through the respiratory. We always hoped it was just droplets, right? But now we know it can be respiratory. It can stay airborne into enclosed spaces without good ventilation. So it's very protective to be outside, but I don't know the answer to that question. And that's a question that I think we need the state to give us at the county levels.
And since it does implicate a state licensing board, by all means, if Senator McGuire or Assemblyman Wood happen to know what's going on with the licensing board for hairdressers, jump in.
Yeah. Yes, Congressman, I'll be very brief. This is an issue that is continuing to be violated. Dr. Doohan is absolutely correct that there is a stop order, if you will, in regards to all haircuts, barbershops, salons, et cetera, indoors in its gray area related to outdoors. And this is an issue that is going to need to be reevaluated. But at this time, not allowed on the state side. It is a gray area, as Dr. Doohan said, and we're going to need to be able to provide hopefully additional guidance next week.
All right. Don't go away, because the second part of Callie Dim's question was about colleges across California, whether we're anticipating distance learning, and I'm seeing different answers from all sorts of different colleges. But Senator McGuire, what is your latest understanding at the college level?
CSUs are going to, California State Universities like Humboldt State or Sonoma State will allow their lab students to be able to come back as long as they're socially distanced, as well as their police and fire academies to be able to come back as long as they're socially distanced. About 15% cap total student body would be allowed to come back for the California State University system. Everyone else will be online. The vast majority community college system will be distance learning. Same exception for lab students as well as the UC system as well. So the vast majority of UC, CSU, and community college students will be learning distance this year, with the exception of lab, as well as those academies for law enforcement and fire.
Okay. This next question is from Marisa. She's asking about something that I've begun to hear a lot from people about, childcare. How can we support private and in-home daycares and preschools to provide care safely and avoid outbreaks in their facilities? If teachers and school staff are expected to provide distance learning, what does that mean for their childcare needs? Do either of my state colleagues want to jump in on this?
Wow, I'll just say that's continuing to evolve, and actually, obviously, childcare is going to be absolutely critical for families, especially that have other older kids that are going to be going to school, and then parents who are working as well. So I don't have an answer for that, and we're happy to try to get one for you. But I don't know, Senator, do you have a better handle on that one?
On just the specifics in regards to the child care side, one more time.
Yeah, the child care, yeah, and provisions. What provisions are being made?
There are some in place, in like the Assembly member. We're going to need to get back if we get the information, and do apologize, but obviously do not want to be coy on this, but also to provide any bad information. So we'd be happy to be able to work with the Assembly member Wood to be able to get back to that individual.
Yeah, there's a lot going on when you think about childcare. I met with some childcare providers just the other day. They have been required to dramatically reduce the number of kids they serve, and they're small businesses. And so their economics are crashing, and they're also being required to spend money on all sorts of upgrades to their facilities, like creating outdoor spaces and other things in order to provide safe childcare. So they're spending more, they're taking in less. It's really important that we continue to provide tools like those small business administration grants and loans, and that we get them out to the micro businesses like these childcare providers. So that's my piece of this. I hear you loud and clear. I want to make sure that the PPP program and other support tools at the federal level are adequate and are set up for the duration here, because we're going to need to help out our child care providers potentially for some time to come.
Congressman, if I may make a comment about what we did in Mendocino County in my orders, I actually see the sheltering in place orders as an opportunity to provide guidance for people about how they can live safely within our COVID pandemic. And so in my orders, there is something described as a stable bubble for childcare. And it's spelled out how you can have childcare, which could be expanded to schooling within a stable group of 12 for at least 4 weeks. And within that stable group, you do not need to have social distancing or wear facial coverings, as long as that group of 12 people does not have any contact outside of that group. And that's for childcare. So that could be extrapolated to schooling. That is in my sheltering in place orders now. I know that the governor and Dr. Angel have seen that, because I've been called on a weekend to explain it, and it's been allowed. So in Mendocino County, at least we can have a stable group of 12 for a minimum of 4 weeks in childcare.
Okay, thank you for that. I had a question for me about the president's or the administration's request that states provide their data in a new form to the federal government, to the HHS agency instead of CDC. And I share the concern. I think there's no good reason for requesting that change. The only reason, and I've heard from former CDC directors, former HHS directors, the only possible reason to do that is to try to politically control and spin the data before it is disclosed to the public and the media. So I'm not a fan of that, and I will be pushing back on it. In the meantime, an obvious thing that states can do is provide the data to both the CDC and HHS and just continue sharing that data, because I think we all want transparency and real-time information. There's a question from Cindy about frustration with local grocery store clerks not wearing face coverings, and also a question about whether the public should be informed if a grocery store or any store in the community has had a positive COVID case. So Dr. Doohan, I think this bounces back to you.
Yes. So what we do in Mendocino County as your health officer is that if there is danger to the public, and there has been, for example, an individual that is working in a store, and that store allows that individual to keep working when they have COVID, or there's an outbreak in a store and they're not responding to what's required by the public health officer, we would disclose the name of that store, and I could shut them down. We have not had any businesses in Mendocino County refuse to cooperate. We have not had businesses where there have been outbreaks that we haven't been able to respond to them and keep the public safe. We do have one situation now that we're tracking very, very closely that's been talked about in social media, and we're on top of it. So in that case, we are tracking these outbreaks as best as we can, keeping in mind that we have a 10-day lag before we get test results. So It's hard to stay on top of these when we're 10 days behind the data. But in terms of enforcing masking, we did, this is very difficult. And we do have a citation process that we put in place that if I'm not saying it correctly, Carmel Angelo is on this call and she could jump in, but we have a citation process in place that we have put before the Board of Supervisors so that we can give citations for people not wearing masks. But the problem is we would need the public safety personnel employed to actually do this enforcement, and we're short-staffed in Mendocino County in that regard, especially coming into fire season and so on. So we need our people to wear masks and comply with the health officer orders and cooperate. That is the best way for enforcement to occur, and we're exploring how we can use this citation hammer essentially to get people to comply if they're not willing to.
Okay, I've got another question about the testing dysfunction, and it's really one for me that I will get to in a moment. But Dr. Doohan, before we let you go, and I think we can squeeze in 2 more questions, and then I'll invite my fellow panelists to share any closing remarks. There's a question from Amy about what other therapeutics are being used to treat COVID patients. Jason mentioned remdesivir. Are you aware of any other therapeutics that are in use either here or elsewhere that are showing promise?
This is our leading therapeutic, is remdesivir, and I, as the physician, as a part of our MOOC, our medical health operation area coordinator, is responsible for approving remdesivir allocations. But remdesivir is not a cure for COVID. It doesn't, it's the best thing we have at this time. And Jason Wells could speak to the fact that through the MOOC, we have been able to get allocations of remdesivir. But good old-fashioned treatment, the best one we have, it seems, is oxygen. This is extremely helpful with COVID. Also, steroids may have some role, but unfortunately, none of the therapies that we have are curative. And we do the best we can in our hospitals to use what we have, remdesivir being perhaps the most effective, but it's only partially helpful.
Jason, do you want to add to that?
I will come off mute. Yeah, Dr. Doohan said it well. I leave the clinical stuff to the physicians, but we have had good success with remdesivir. I think our physicians are constantly scouring the literature to make sure they are on the latest cutting edge of what we're seeing. Successful in Texas, successful in Florida, and then that's the value of the 2,000 physicians collaborating across Adventist Health, just learning from the best practices. So sometimes it's rough to be at the end of the line. It's nice that Mendocino County was you shared earlier, I think Senator McGuire, we've had time to prepare. But wearing our mask is the best thing we can do to keep people safe, track those symptoms, and people need to absolutely not be around other people if they do have symptoms until they can get that positive test back. On the question earlier, it's not an issue of money. If we could buy the test kits, we would. It really is the supply chain. So we appreciate your support federally and then at all levels of government of seeing what we can do to increase the supply chain around the testing supplies.
Yeah, thank you. And that's a great segue to the last question that we'll be able to handle. It's from Jeffrey. And it is about this system failure. Why are we always behind on the materials that we need to do the testing, the lab capacity? It's always the collection kits, the transport medium, the reagents, the pipettes, or the lab capacity. And we're just nowhere near where we all thought and hoped we would be. Although the state is making a heroic effort, I will say that. And there's an obvious reason for that. The demand on the system is extreme. These numbers are going up, and there's only one tool that can commandeer the manufacturing capacity and the lab capacity that we just have to create. And it is federal law. It's a law called the Defense Production Act. It is meant for extreme emergencies, for wartime and other situations where you've just got to commandeer supply chains and make sure you don't have shortages and make sure there's no price gouging and make sure you have orderly distribution of vital resources during a crisis. President Trump won't invoke it. He won't use it. And it is just an extreme frustration. Part of that, maybe some notion of wanting this to be handled by states and local governments. I have to believe part of it, though, is what he tells us. He doesn't like testing. He believes testing creates cases, and that the number of cases, if it goes up, makes him look bad. It is so politically craven and crass, I can't even believe anyone, much less a president of the United States, would say it. But he has said that multiple times. And it's really the only thing that explains his stubborn refusal to do what anyone else would do in his place. So we're going to keep pushing that provision, the mandated use of the Defense Production Act, to have a national strategic plan on testing capacity, on labs, on all the PPEs to make sure we don't have shortages coming down the pike. And by the way, on vaccines, because vaccines are coming too. And if we have the same hands-off lack of leadership and strategic direction from the federal government on vaccines, we're going to have the same frustrations and chaos and shortages that we're experiencing now with testing. So we've just got to do this. And that provision in the HEROES Act is vitally important. It's the only way that all of these frustrations you're hearing from our healthcare providers, from my state colleagues, from the governor, it's the only way we're going to get it resolved. I hope we can do it with this administration. If we can't, then I think the voters of the United States are going to have to decide on November 3rd whether they want to have national strategic leadership on this or whether they want to continue the status quo. So with that, I want to invite Assemblyman Wood to offer any closing thoughts that he may have, and we'll go down the line and wrap this up.
Well, thank you very much, Congressman Huffman. And I just want to piggyback a little bit on what you said regarding testing as my close. This is something we have been grappling with and struggling with since the very beginning. And I do want to commend, and certainly in California, some businesses have been able to repurpose their manufacturing to help with some of the supplies that we need. Things like helping to produce face shields and gowns and things like that. We have tremendous manufacturing capacity here in California, but I agree with the Congressman Huffman, we cannot do it alone. The reagents, the plastics, and that Jason Wells hit on that right away. These are very specialized products that are not easy to mass produce. And so without the resources to really ramp that up, we're going to continue to fight behind the 8 ball. But I will tell you how far we've come, and I think you have to reflect upon that. And that is, at one point we were a few hundred to 2,000 tests a day in California, and most recently we had a day at 147,000 tests, and we are routinely doing over 100,000 a day. That's not enough, but we have come a long way. We have a long ways to go, and we're committed to continuing to fight to get that done. So. I just want to say thank you to everybody for the opportunity to be here tonight. Our office, I would go back to that, is if you have questions or concerns, please, the state agencies, anything we didn't cover tonight, and we'll get, even also, in addition, the issue concerned about childcare. If you need additional details or if there's anything that's unclear, feel free to call our office and speak with either Ruth or Emily. And that number is 463-5770. And I just want to say thank you for the opportunity to be here. Just know that we're in constant communication with the senator, with the congressman, with everybody involved here, and we're doing the very best we can for you. And we'll continue to fight every day for Mendocino County. Thank you.
Really appreciate you joining us, Jim. Thank you for your leadership. Senator McGuire.
Congressman, again, thank you for bringing us together today. We are truly appreciative of your leadership, to the hard work of Dr. Doohan, of course, Mr. Wells, and to amazing state partner, Jim Wood. Thank you so much for the opportunity to be able to work with you, and thank you for tuning in today. I'll just end it here with a pause. It's outrageous to think that the United States of America, the strongest nation on earth, the wealthiest nation on earth, doesn't have a national strategy when it comes to combating this virus. And it's thanks to folks like Congressman Huffman, who continues to put extreme pressure on to this administration to be able to get their act together, why we're here today, and have made significant progress. And we are in some trouble right now. We are in for a challenging fall and a challenging winter if we don't get our act together as a community and as a state. These surges are 100% avoidable right now. It's wearing your mask, it's keeping your distance, and it's staying at home. And if you don't want to focus on the issue of public health, focus on economic prosperity. We can keep our economy open if we do the right thing during this pandemic. Keep your distance, wear your mask, and stay at home when you can. The bottom line is this. An average vaccine takes about a decade to get to market. A fast-track vaccine takes 4 to 5 years. Right now, we're talking 12 to 18 months from now. That means that we're in this for the long haul, which means we have to work together and lead and wear a mask, keep your distance, and stay at home. And thank you again, Congressman, for your incredible work. And thanks for allowing me to take part today.
Well said, Senator. Thank you so much for everything you bring into this effort. Let's go to Jason, and then we'll let Dr. Doohan close us out.
I agree with everything that's been said. Wear our masks. If we all can continue to do that and stay that 6 feet, we will help continue to flatten this curve and not see some of these little spikes that we've been seeing along the way. Know that your healthcare partners, your FQHC partners, the clinics, our primary care, our independent clinics like Bechtel Creek, up in Willits, Anderson Valley, all of the clinics out there are collaborating, talking about the response. Clinics are absolutely the best place to kind of get that COVID test if you need to get it to return to work, or you're concerned, or your stress is higher. You know, emergency department's really not the best place to get just standard. Now, if you've got symptoms and, you know, can't get into primary care, absolutely, we're here for you. So let's just make sure that, you know, we're kind of doing the testing in the right place. More testing is coming online in about 6 weeks, we're being told. So it's going to be a bumpy 6 weeks till we get more of those allocations. We're trying to get our hands on absolutely everything that we can get. Thank you for your support. We have had amazing support from Factory Pipe, making special things for us to put tents over our COVID patients. We've had support from the college, making face masks on the 3D printers, and just tremendous donations and just love and support. Finally, I just say, take care of yourself. This is a stressful time. Financial stress on everybody, job stress, and then we're seeing an increase. We're seeing an increase in assault, domestic battery. Some of the stuff we're seeing is heartbreaking in our emergency departments. And so be there for a friend, find that support that you need, whether it's spiritual, social, whatever that is. We will get through this as a country, as a community. And I'm very impressed with the people we've got on this call. Thank you for your partnership.
Well, thank you, Jason, and thanks to your team at Adventist Health and your 3 hospitals. Our ability to coordinate between the clinics, hospitals, and public health authorities is vital to getting us through. And we've had that teamwork in Mendocino County, and I'm grateful for it. So we will, with that, close out with Dr. Doohan. Final thoughts for those who've joined us for this town hall, Doctor.
Thank you, Congressman. From the very beginning of this pandemic, we talked about containment and mitigation. Containment is what we're doing every day with our communicable diseases team, trying to find the outbreaks, those fires that we're looking for, and put them out. And then mitigation, that's where we're slowing the spread, we're flattening the curve, we're asking people to social distance, wear their masks and so on. In this journey that we've been going on together, there have been many, many inspirational times. And I particularly want to reflect on our congressman, our assemblyman, and our senator here. You heard our call, our plea in Mendocino County that we needed more testing, and you got us OptumServe. And I have to tell you that OptumServe has saved lives. There is no question about it. This OptumServe resource, which comes from the state, we've been using it at maximum capacity, and it has really helped us in Mendocino County. So I want to thank you. And this is one of the examples of how our great leadership has come together in a time of need. As we move forward, what I want to ask all of us to is be more adaptable. We are going into this horrible fear about what is it going to mean for our children, that they can't go to school in their normal schooling. I have children myself. I know how much we love the traditions of school. We need to make new traditions for ourselves now. Our stable bubbles, our ability to have ways to have education in the fall that are going to feel good to our kids, even though they have to have this element of distance learning. So this is going to be my hope for Mendocino County. We're a very resilient people. We're people that we love our county. We have a lot of care for each other, and we are resilient. Let's adapt. Let's find ways to really have a good life in this setting, as Senator McGuire has said, rightfully so, that's going to be with us for quite some time. Let's not live in anxiety. Let's live with hope. And we need to not have gatherings. So please have small, stable groups of people that you get together with, not parties, but let's find the hope in every day, the beauty in every day, because it's all around us everywhere. Thank you.
That's a wonderful thought to end on. Thanks so much, Dr. Doohan, and thanks again to all of my colleagues, state legislative colleagues, and our two public health experts. Thanks to everyone who has logged in for this town hall. I hope we provided you some useful information and some helpful thoughts on how we're all going to get through this together. We'll do it again, I hope. Take care. Stay safe. We're logging off.